Side note, if you have an order to obtain a urinary specimen at the time of the catheter insertion, you can do that one of two ways. The first way is to clean this port with an alcohol swab. Some of these are needleless ports, but this particular one you would insert a needle and draw urine out. The second way is you can get a specimen from the bag, but only right after insertion. If the catheter is inserted and you leave the room, you can no longer get that specimen from the bag. It has to be when you insert the catheter. Once you've inserted the catheter, throw your supplies away, your trash away, and then provide comfort for your patient. Make sure they're covered back up and that they have the blanket back on them before you leave. Make sure they don't need anything, and then lower the bed to the lowest position and you're able to leave the room. Before I leave the room, I'm going to show you how to discontinue this Foley catheter. One thing I would like to bring to the room to discontinue a catheter is either a towel or a Chuck's pad to put underneath the patient to prevent their bed from getting wet. Again, you want to provide patient comfort and privacy, so we're going to do all the same things that we did before and ensure we have the correct patient. I always place the towel underneath the patient's perineum to ensure that I'm keeping the bed dry as well as keeping the patient as clean as possible. I'm going to bring a clean syringe to the patient's room to deflate the bulb. I always want to empty my Foley catheter bag prior to de-seeing the catheter and measure the output. Next, you want to take the securing device off the patient's leg, probably using an alcohol pad to loosen the adhesive. Once you've done that, you attach the syringe back to the port. Sometimes you may have to apply slight resistance to the syringe to be able to get the liquid to come out. But as you can see, the liquid is coming out on its own after I've applied slight resistance. Once the plunger stops going back, I always pull back just a little bit more to make sure there's no more liquid in the bulb. Ask the patient to take a deep breath and simply pull the catheter tubing out. You want to dispose of the catheter bag and tubing as the policy of the facility. Some facilities will ask you to dispose of it in a red bag, others will simply put it in the trash. Do it as the facility says to do it. Again, after you're done with the procedure, you want to cover your patient back up and provide privacy.